Hello, I'm Maria. I'm CEO and co-founder of digitAAL. In cooperation with research and application partners, we have developed BrainMe, a novel software which supports therapy of Alzheimer's. With our deep technology, we will be the only ones to combine diagnostics and monitoring of Alzheimer's and dementia, a game changer in the European market. Dementia is a 2 trillion challenge worldwide, with no cure in sight and increasing rapidly due to the aging population. It also creates a huge burden and cost to society and its care system. The disease is still incurable and medication offers only limited help. Therefore, the World Health Organization recommends behavior-oriented activating therapies like ours as the only effective approach. Our current software, BrainMe, can easily be used by patients at home with or without help of their families and caregivers, and will be certified as a medical device this year. Leading doctors were also asking us for a diagnostics tool, which we will now develop. This is BrainMe Diagnostics, a brand new and globally unique way to diagnose and monitoring Alzheimer's and dementia. It calculates digital biomarkers by combining our proprietary eye tracking technology with performance data collected during the training. These biomarkers allow us to get an accurate picture of the patient and the cognitive status continuously instead of only once a year. The combination of therapy and diagnostics in one solution provides adaptive, personalized therapy of Alzheimer's. The clinical RCT study, multimodal with Red Cross and Medical University Graz, has already proven to slow down the progression of Alzheimer's dementia. BrainMe Diagnostics will bring unique benefits to several stakeholders like doctors, psychologists, and professional caregivers, feedback to patients and their families, and efficient monitoring of the disease to social insurances. The total addressable market in Europe is about 10 million people, with 2.5 million newly diagnosed every year. And they first need diagnostics and then continuous therapy and monitoring of the disease. Our first markets, Germany and Austria, there are 140,000 professionals working with Alzheimer's patients and 1.8 million patients. We have a highly scalable business model and sell a software as a service, and we are a very balanced and diversified team.
Turn off the mic, as it's the rules. I'm very, very sorry. You crossed the 3 minutes red line, but although
it's the last slide.
Although we allow for some jury questions.
Yes.
Thank you, Maria. My first question is on the product. I did not understand it quite well. It's a combination of digital and analog tools, or it's only a digital?
It's just the software. You can install it on a consumer tablet.
How do you deal then with digital illiteracy, which is a big issue? And I don't now speak about age. It's a problem for many people. So how do you deal it that they really can do it? And then you said also that the product has been approved will be approved this year as medical device.
Yes.
So how long has this taken?
Yes. Digital illiteracy is not such a big problem because we use the software on a tablet, which is easy to use. We give hints also to caregivers and families how to use this. And in the beginning, of course, you need some guidance, and maybe you can do it then alone, or maybe you need the guidance also during the training. But that's not the problem. And in our field studies, we have very good experience, and we get very good feedback from care organizations on that. Second question was?
Medical device, how long?
Medical device, yes. We will hand in all the documents by end of July to the notified body. It will be a medical device, class 2A, according to the new MDR, for the Alzheimer's therapy part. And when we develop the diagnostics part, we will grade it up, so to say, for the diagnostics part as well.
What are your plans for developing the system further on? So I guess there are games or something like that. So
It's a structured training of 45 or 25 minutes, depending on how many time you have. This is, so to say, the algorithms, how we treat Alzheimer's, and by the same time, we can also monitor and diagnose. So it's twofold, the benefit. And we start with Alzheimer's dementia, but we also have a research project running on a long
And I have to interrupt you right now. The time is over.
And there are many other diseases where it can bring huge value.